If you have
Staying
ever felt
informed
an
about your health
unexpected
is
momentary
essential.
wobble in your
Remember
knee
to
while
schedule
stepping off a
regular
street
checkups
curb,
and don't
or noticed a
hesitate to
subtle,
ask
dull
questions.
ache behind your kneecap when climbing up a flight of stairs, you must treat these subtle warning signals with immediate clinical attention.
Oh.
The human knee joint does not simply deteriorate
Be
overnight.
careful.
Rather, it undergoes
one
a
step at a
silent,
time.
progressive structural breakdown long before severe osteoarthritis, bone-on-bone grinding, or excruciating joint inflammation force you to seek invasive medical interventions. As we navigate past the age of 60, our muscular biology undergoes a rapid accelerated shift where the primary inner stabilizer of the knee capsule, known scientifically as the vastus medialis oblique or inner quadriceps teardrop, begins to atrophy at an alarming rate. When this specific teardrop-shaped inner thigh muscle loses its contractile power and structural mass, your kneecap loses its central magnetic pull and begins to track off-center, dragging violently across the delicate articular cartilage of your thigh bone with every single step you take. Tragically, millions of aging seniors completely misinterpret this subtle early leg weakness as an inevitable, harmless byproduct of getting older, unknowingly allowing their internal knee alignment to collapse deeper into joint friction day after day. Every single step taken with a misaligned, unstable kneecap creates high mechanical shear stress that grinds down remaining articular cartilage padding, accelerating cartilage thinning, triggering localized inflammatory fluid buildup, and drastically increasing your risk of sudden balance loss. To make matters worse, when your inner knee stabilizers fail, your central nervous system automatically forces secondary muscle groups to compensate, shifting excessive biomechanical strain upward into your hips and lower lumbar spine, leading to severe chronic lower back stiffness and hip pain. The heartbreaking reality facing aging adults is that conventional, high-impact gym exercises such as heavy leg extension machines, deep-weighted squats, or aggressive lunges place hundreds of pounds of destructive compressive force onto fragile, thinning cartilage capsules. What if clinical orthopedic science conclusively proved that you can completely reactivate your inner quadriceps teardrop using an isometric, non-impact exercise that places zero mechanical compression on your sensitive joint capsule? This specialized rehabilitation movement specifically targets and re-educates the dormant motor units within the vastus medialis muscle, generating sufficient localized tension to gently pull your kneecap directly back into its smooth, central anatomical groove. By re-establishing perfect patellofemoral tracking, you instantly arrest destructive cartilage grinding, quell localized synovial inflammation, and rebuild an unshakable sense of physical balance and stability during daily walking. Furthermore, rebuilding this inner quadriceps teardrop converts your thigh muscle into a high-performance internal hydraulic shock absorber, absorbing foot strike impact forces before they can ever reach your knee bones or lumbar vertebrae. You do not have to accept chronic knee stiffness, surrender your independence to walking canes, or prepare yourself emotionally for painful, costly knee replacement surgeries as an unavoidable consequence of aging. Your biological system retains a remarkable, lifelong neuromuscular plasticity that allows aging muscle fibers to rebuild, synthesize protein, and stimulate fresh synovial fluid circulation, regardless of whether you are 60, 70, or 80 years old. In this comprehensive clinical guide, Dr. Robbert will reveal the precise step-by-step biomechanics of this breakthrough exercise, allowing you to execute it safely today, right from your living room chair. This therapeutic movement requires absolutely no expensive athletic machinery, no specialized equipment, and can be completed in under 3 minutes of gentle, focused movement each morning. By committing just a few short minutes each day to this clinical rehabilitation protocol, you can fortify your lower extremities, safeguard your independence, and dramatically lower your risk of catastrophic trip and fall injuries. Before we transition into the physical demonstration of this targeted movement, let us perform a detailed medical deep dive into the internal biomechanics of how kneecap tracking dictates joint longevity. Let us examine the exact anatomical structure of your leg muscles, joint capsules, and cartilage layers to understand precisely why inner quadriceps strength is the ultimate secret to lifelong mobility. Sit comfortably, take a deep breath, and prepare to discover the exact medical secrets that will transform your knee health and restore your confidence in every step. To comprehend why your knee joint complex weakens first among all lower extremity structures, we must analyze the intricate biomechanical engineering of your quadriceps muscle group. The human quadriceps architecture consists of four distinct, powerful muscle bellies: the rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis, which all converge on the upper border of the patella via the broad quadriceps tendon. While the larger outer muscles exert a strong outward and upward pull on your kneecap during dynamic movements, only the vastus medialis oblique fibers exert a counterbalancing inward pull to keep the kneecap perfectly centered. Crucially, sports medicine and clinical research demonstrate that the vastus medialis muscle is only fully recruited and activated during the final 15 degrees of full leg extension, meaning standard walking on flat surfaces fails to train it. When you spend hours sitting in a chair, the neural signaling to this inner muscle diminishes dramatically, allowing the dominant outer quadriceps to pull your kneecap laterally out of its natural trochlear groove. This mechanical tracking imbalance causes the smooth articular cartilage on the back of your kneecap to scrape unevenly against the rough bone surface of your femur, generating progressive microfriction, wear, and eventual chronic pain. Our primary clinical rehabilitation exercise, designed to directly eliminate this patellar tracking friction, is the seated terminal knee extension with towel squeeze. To set up this exercise properly, sit firmly upright on a solid, non-cushioned chair with your spine straight, shoulders relaxed, and your feet resting flat on the floor at a 90-degree angle. Take a small, tightly rolled hand towel and place it firmly between your inner knees, squeezing your thighs inward against the towel to instantly recruit your adductors and vastus medialis motor units. While maintaining a continuous, firm squeeze on the towel, slowly raise your right lower leg upward until your knee achieves full horizontal extension parallel to the floor. At the top of this movement, lock your knee gently without slamming the joint. Pull your toes firmly back toward your shin and squeeze that inner teardrop muscle intensely for 3 full seconds. Direct your mental focus entirely into the inner thigh muscle sitting right above the inner border of your kneecap, feeling the neuromuscular connection fire strongly under the contraction. Slowly lower your foot back down to the floor over a controlled 3-second eccentric phase, ensuring you never release the inward squeeze on the rolled towel throughout the entire movement. Complete 10 full, slow repetitions on your right leg before pausing for a brief respiratory break and repeating the identical sequence on your left leg. This specialized terminal extension fires the precise motor units required to pull your patella back into its optimal anatomical pathway without placing any heavy external loads on your joint. Because your foot is floating freely in space during this open kinetic chain movement, there is absolute zero vertical weight compression, forcing your femoral and tibial cartilage surfaces together. Executing 2 sets of 10 repetitions each morning provides your central nervous system with the exact mechanical input required to permanently restore natural patellar tracking. Seniors who integrate this clinical movement into their daily routine routinely report an immediate sensation of warmth, increased joint stability, and a sharp reduction in front knee tightness. Let us now examine the second crucial component of this knee protection system, designed specifically to strengthen your hamstring muscles and fortify the back of your knee capsule. Understanding how posterior knee stability protects your anterior cruciate ligament will give you total control over your joint longevity. Protecting and fortifying the rear aspect of your knee joint complex requires equal clinical attention to your hamstring muscle group and the small, crucial popliteus tendon tucked behind the joint. The hamstring muscles, consisting of the semitendinosus, semimembranosus, and biceps femoris, function as the primary dynamic brakes for your lower leg, physically preventing your tibia from shearing excessively forward beneath your femur. When your hamstrings become weak, elongated, or structurally inactive due to extended sedentary hours, your knee capsule completely loses its posterior stabilization anchor, leaving your anterior cruciate ligament under perpetual strain. To restore perfect agonist-antagonist muscle balance and fortify posterior joint integrity, we systematically pair our inner quadriceps terminal extensions with seated isometric heel digs. Sit forward toward the front edge of a firm, stable chair, keeping your spine erect and chest open, and extend your right leg forward so that only your right heel rests firmly against the floor. Without bending your spine, press your right heel down into the floor with intent, simultaneously pulling the heel backward toward the chair, as if attempting to bunch up a rug without actually moving your foot. Hold this powerful isometric contraction for 5 full seconds, focusing your mind on feeling the deep muscular activation firing along the back of your thigh and directly behind your knee. Release the downward tension slowly. Take a calm, deep breath, and repeat this controlled isometric heel dig for 8 to 10 deliberate repetitions before switching to your left leg. This specialized isometric contraction strengthens the distal hamstring tendons right at their crucial anatomical insertion points on the tibia and fibula, reinforcing your knee's posterior wall. Furthermore, engaging the hamstrings triggers reciprocal inhibition of the tight anterior structures, immediately decompressing the patellar tendon and taking painful tension off the front of your kneecap. By establishing symmetrical muscular tension between your inner vastus medialis and your hamstrings, you effectively construct a robust, 360-degree protective sleeve around your entire knee joint. Seniors who combine these two targeted seated drills experience a rapid increase in joint confidence, completely eliminating that terrifying feeling that their knee might suddenly buckle or give out under weight. Now that we have established a strong muscular framework, we must address the internal biological environment of the joint capsule, which is necessary for long-term cartilage survival and repair. Targeted physical exercises provide the essential mechanical stimulus, but systemic anti-inflammatory habits and proper cellular hydration dictate how rapidly your cartilage matrix can recover and rebuild. Without the necessary joint fluid viscosity and biological building blocks, even the lowest impact movements can create subtle friction inside dry, compromised articular cartilage. Proper hydration ensures that the protective synovial fluid retains its viscous gel-like properties, creating a slippery cushion that prevents direct bone contact. In addition to cellular hydration, consuming anti-inflammatory micronutrients provides your cartilage cells with collagen peptides and glucosamine required to repair daily microscopic wear. Let us now explore the essential nutritional strategies, hydration protocols, and daily habits that keep your knee cartilage lubricated, cushioned, and pain-free at any age. Understanding how to preserve your natural synovial fluid will transform your joint health and allow your cartilage cells to thrive for decades to come. Together, muscle strength, optimal hydration, and tissue nutrition form an unbreakable triad of lifelong orthopedic resilience. The first major mistake that many aging seniors unknowingly commit is brushing off or ignoring subtle crackling, popping, or crunching sounds emanating from inside the knee joint during routine daily movements. While painless, high-pitched popping is often just a harmless release of gas bubbles within the joint capsule, persistent crepitus accompanied by a sensation of rough grinding indicates that your protective articular cartilage has developed surface roughness. Never force your joints through painful grinding noises. The moment you feel mechanical friction, immediately transition to non-weight-bearing seated exercises to stimulate fresh synovial fluid flow and lubricate the damaged cartilage surfaces. The second critical clinical error is relying continuously on tight elastic knee sleeves or rigid external knee braces for extended hours throughout the daytime. While specialized orthopedic braces certainly offer temporary pain relief during acute flare-ups, wearing them continuously causes your nervous system to downregulate your natural stabilizing muscles, accelerating vastus medialis atrophy. Utilize supportive knee sleeves strictly as a temporary aid during acute discomfort, while actively prioritizing your daily targeted seated exercises to rebuild your body's natural muscular support sleeve. The third mistake is performing heavy leg presses, deep squats, or weighted steps with your knees caving inward toward each other. a dangerous movement pattern known as knee valgus. Inward knee collapse exerts intense, asymmetrical torsional shearing stress across your anterior cruciate ligament and violently compresses the lateral meniscus against your femoral condyle, destroying cartilage padding. Whenever you bend your legs during exercise or daily movement, make a conscious effort to keep your knees tracking directly in line with your second and third toes to preserve optimal joint mechanics. The fourth major error is sitting for prolonged stretches with your legs bent back tightly beneath your chair, placing your knees in extreme flexed angles for hours at a time. Maintaining extreme knee flexion dramatically elevates patellofemoral compressive force, squeezing fluid out of your articular cartilage and restricting internal blood and synovial circulation around the kneecap. Keep your knees resting comfortably at an open 90-degree angle or extended slightly forward while seated to ensure unhindered nutrient and fluid diffusion throughout your joint capsule. The fifth critical mistake is neglecting daily hydration, under the false assumption that drinking adequate water only impacts cardiovascular function and kidney filtration. Articular cartilage is structurally composed of up to 80% water retained within a matrix of proteoglycans. Chronic, low-grade dehydration causes cartilage cells to shrink and lose their natural elasticity. By drinking fresh, clean water consistently throughout the day, you maintain rich joint fluid viscosity, keeping your knee cartilage plump, resilient, and ready to absorb dynamic daily impacts. When cartilage loses its fluid content, mechanical shock is transferred directly to the underlying subchondral bone, causing microfractures and chronic pain. Avoiding these common mechanical pitfalls preserves your joint structure, allowing your inner quadriceps and hamstrings to function with maximum mechanical efficiency. Eliminating these 5 harmful habits removes the constant mechanical and biological stress that quietly wears down your knee joints every single day. Now, let us integrate these clinical insights into a smooth, seamless daily protocol that will rebuild your leg strength and preserve your mobility for decades to come. Taking proactive control of your lower extremity biomechanics today ensures that you maintain complete independence and freedom of movement well into your 90s. Welcome to the fifth and final phase, your comprehensive daily knee strengthening, patellar tracking, and joint stability blueprint. In the realm of orthopedic rehabilitation, long-term consistency is exponentially more powerful than short bursts of high-intensity exercise when it comes to rebuilding inner quadriceps motor units and preserving aging cartilage. Begin every single morning immediately after waking up by drinking a full glass of fresh, room-temperature water to rehydrate your cellular tissues and restore lost fluid to your articular cartilage matrix after hours of sleep. While seated comfortably in your morning chair, execute 10 controlled seated terminal knee extensions with a towel squeezed firmly between your knees on each leg, focusing intently on locking out the final 15 degrees of movement. Squeeze that inner vastus medialis teardrop muscle intensely at peak extension for 3 full seconds on every single repetition, forcing motor units to fire and pulling your kneecap back into its optimal trochlear groove. Follow your extension sequence immediately with 10 isometric seated heel digs per leg, pressing your heel down and pulling backward to contract your hamstrings and anchor the posterior wall of your knee capsule. This complete targeted routine requires less than 3 minutes of your time each morning, establishing an unshakable foundation of muscular support and joint lubrication before you take a single step into your day. Whenever you transition from sitting to standing throughout the day, maintain conscious mindfulness over your alignment, ensuring your knees drive directly over your middle toes without caving inward toward each other. If your lifestyle involves prolonged sitting, set a gentle hourly reminder to stand up, adjust your leg posture, and execute 5 unweighted leg extensions to keep fresh synovial fluid circulating through your cartilage. In the evening, fuel your body's cellular recovery mechanisms with a wholesome, nutrient-dense meal rich in clean proteins, omega-3 fatty acids, and natural antioxidants to calm systemic joint inflammation. Within the first 10 days of adhering to this daily protocol, you will experience a distinct, noticeable reduction in morning front knee tightness, grinding sensations, and patellar crepitus. Between days 11 and 20, as the vastus medialis rebuilds its structural tone, your kneecap will stay firmly centered, completely eliminating that terrifying sensation of sudden leg wobbling or joint instability. By day 30, balanced 360-degree muscular support surrounding your entire knee capsule will empower you to navigate curbs, stairs, and uneven terrain with total, effortless confidence. In addition to physical strength, your mind will feel liberated from the constant anxiety and fear of experiencing sudden joint pain during outdoor walks. Always remember that joint structural recovery is a gradual biological journey that rewards steady daily commitment rather than sudden overexertion or pushing through sharp, warning pain. Listen attentively to your body's signals, honor your progress, and take deep pride in every smooth, pain-free step you take toward reclaiming your lifelong physical independence. Sharing this gentle, scientifically proven knee protection secret with your friends and loved ones will inspire everyone around you to take proactive, empowering control of their mobility and joint health. You now possess the exact clinical biomechanics, targeted rehabilitation protocols, and daily joint blueprint needed to lock your knees into lifelong stability and protection. Take charge of your health today, rebuild your natural muscular knee sleeve, and give your joint capsules the gentle strength, hydration, and stability they truly deserve. This is Dr. Robbert, wishing you vibrant physical health, resilient, pain-free knees, and a steady, confident stride every single day of your life.